So if you've got ADHD, you know all about stimulants, right? But what happens when that medication, the one that's supposed to help you focus, still leaves you feeling completely disorganized and just overwhelmed? Well, in this explainer, we're going to look beyond the usual suspects. We're diving into a different way to manage ADHD, one that really hones in on those super frustrating problems that stimulants just seem to miss.
So let me ask you, does this sound familiar? You're on your meds, and yeah, your focus is better, but you're still struggling to plan your day, or you can't switch between tasks without your brain just grinding to a halt. Or maybe it's managing those emotional flare-ups. If any of that hits home, I want you to know you are so not alone. This actually points to a pretty big gap in the way we usually treat ADHD, and it's something we really need to talk about.
All right, so let's start with the big one. Stimulants. I mean, they're the go-to treatment for ADHD, and for good reason. But here's the thing. They have a very, very specific job. And understanding what they don't do, what we're going to call the stimulant blind spot, that's really the key to unlocking a better solution.
Okay, so stimulants like Adderall or Ritalin, they are fantastic at boosting your brain's raw processing power. You know, that's your attention, your concentration, taming that hyperactivity, all the stuff you see on the left. They basically crank up the dopamine in your brain, which is your focus and reward chemical. But, and this is a huge but, they were never designed to help with the skills you see on the right. We're talking about planning, organization, time management, the real adulting stuff. Any little boost you might feel in those areas, it's usually just a side effect, and poof, it's gone the second the meds wear off.
And this brings us to a massive and, honestly, often overlooked challenge in ADHD. It's called the set shifting problem. This is the exact reason why one tiny little interruption can feel like it completely blows up your entire day. Let's walk through a scenario that I think you'll find pretty familiar.
So what on earth is set shifting? The best way to think about it is like the clutch in a car, right? It's your brain's ability to smoothly switch gears, to disengage from one task, engage with something new, and then slide right back into that first task without, that awful gear grinding feeling. For so many people with ADHD, that mental clutch is just sticky. It makes every transition feel jarring and way harder than it should be.
Okay, so picture this. You are in the zone. You know that feeling? You're locked in, you're being productive, you're actually making progress on that big, important thing. That's your hyperfocus finally working for you, not against you. It feels great.
And then, bam, it happens. The Slack notification dings. You get a tap on the shoulder. Hey, got a sec? Can we just jump on a quick 15-minute call? It sounds so harmless, right? I mean, it's just 15 minutes. What's the big deal? Well, for someone with a set shifting problem, that quick call is basically a productivity bomb. You finish the call, you turn back to your work, and it's just gone. Nothing. The focus is completely shattered, and the amount of mental energy it takes to get back in that zone, it can take an hour, sometimes even longer. It's maddening. Yeah, this quote just nails it. It's like being on a fast-moving train that derails. Think about that. The interruption doesn't just pause you. It throws you completely off the tracks. All that smooth forward momentum is just gone, and what's left is just friction and total mental chaos. So if stimulants aren't the right tool to stop this kind of derailment, then what is? Well, this is where a whole different class of medications enters the picture. Non-stimulants. They work in a totally different way. Instead of just focusing on dopamine, they primarily work on something called norepinephrine, a brain chemical that's directly tied to those executive functions like planning and staying organized. Now, to be clear, non-stimulants aren't some brand new invention. Strattera, for example, has been around for more than 20 years. But for a really long time, the options were pretty limited, especially for adults. The real news, the game changer, came in 2021 with the approval of a drug called Qelbree. And this one is showing some serious promise for filling in exactly these kinds of executive function gaps.
Okay, so let's zoom in on Qelbree, because it really is a huge development here. This might just be the missing piece of the puzzle we've been looking for. So when you put Qelbree head-to-head with Strattera, which has been the main non-stimulant option forever, a big study in 2023 found two major advantages for Qelbree. First off, speed. Qelbree can start working in just 1 or 2 weeks. Strattera, that can take a month, maybe even more. And second, that same study showed it was just plain more effective. I mean, that is a massive step forward. But wait, it gets even better. This is maybe the most stunning finding of all. In one study, they took patients who were already on a stimulant and they just added Qelbree to their routine. Get this, a staggering 85% of them were eventually able to stop taking their stimulant completely. For the vast majority, Qelbree was all they needed.
Look at that chart. That huge slice, 85%, that's all people who didn't need a stimulant anymore. This tells us that Qelbree isn't just some add-on or helper medication. For a lot of people, it could be a total replacement that offers a much more targeted kind of support right where they need it, with executive function. And this all brings us right back to that set-shifting problem we talked about. A key study showed that Qelbree significantly cut down on those executive function deficits. Now, we got to be transparent here. That specific study was done with kids, but the fact that the medication is proven to work on these exact skills, that is incredibly promising for adults too.
Okay, so you have all this information now. What do you do with it? Look, this is not about self-diagnosing or anything like that. The whole point here is to empower you so you can walk into your doctor's office and have a much more informed, productive conversation. Here's a really simple 3-step action plan for you. Step 1. Just evaluate your own symptoms. Really think about it. Are those executive function struggles, the planning, the task switching, are those your biggest hurdles, even on meds? Step 2. Just know your options. Understand that these non-stimulants exist for this exact reason. And finally, step 3. Talk to your doctor. Bring this up, ask them directly if a non-stimulant like Qelbree could be right for you.
And hey, just one last practical note here. Since Qelbree is still a newer brand-name drug, you might run into a little insurance red tape. Your doctor will probably have to get something called a prior authorization. Some insurance companies might even make you try an older drug like Strattera first before they'll cover it. It's not a deal breaker, just something to be aware of so you're not surprised.
You know, for years and years, the entire conversation about ADHD medication has really just been about stimulants. But as we've just seen, that's not the whole story, not even close. So if you're the one who's struggling with the planning, the organizing, the constant derailments from interruptions, the real question you should be asking yourself is this: could a non-stimulant be the missing piece of your ADHD puzzle?